Hello, everyone. My name is Michaela Olsis, and today I'll be telling you about my paper on substance use disorder in corrections. The research question for this paper was, does the increased implementation of harm reduction strategies and treatment programs for substance use disorder in correctional facilities result in lower rates of recidivism and deadly overdose? Key terms for this paper were substance use disorder, demographics, harm reduction, the sequential intercept model, police and courts, and therapeutic versus pharmaceutical treatments. Substance use disorder can be defined as a condition in which individuals' use of psychoactive substances severely impairs daily life on both a physical and psychological level. The two most common substances talked about in this paper were opioids and alcohol. Some of the common withdrawal symptoms that can be seen in individuals entering incarceration with substance use disorder are vomiting, diarrhea, increased pulse, depression, and dysphoria. The demographics for this paper, I focused on factors that contribute to SUD, racial, ethnic differences, and gender differences. Factors that contribute to SUD include childhood trauma, abuse, neglect, sexual assault, and household deprivation. Minority groups are less likely to enter into substance use treatment or be offered substance use treatment as opposed to jail or prison sentence. Women are less likely to be diagnosed with substance use disorder, but when diagnosed, tend to be more severe as their male counterpart. Harm reduction can be defined as the acknowledgement that substance use disorder exists and that it is an issue that cannot be simply solved overnight. Some examples of harm reduction strategies include clean syringe and needle programs, naloxone or Narcan distribution, and medication-assisted treatment. The sequential intercept model is a model that allows for the collaboration between the criminal justice system, community, and mental health services to create the best possible plan to prevent recidivism for an individual suffering from substance use disorder. If you refer to the figure below, you'll see intercepts 0 through 5. Within these intercepts, all of the program and harm reduction strategies fall. For example, in intercept 1, law enforcement, this is where you would see pre-arrest diversion programs. In intercept 3, jails and courts, this is where you would see drug treatment courts. And in intercept 4, reentry, this is where you would see naloxone or Narcan distribution. Police and courts. Pre-arrest diversion are programs that are created to prevent incarceration or being charged for a crime at all. The target is first-time offenders or low-level offenders. One major example of a pre-arrest diversion program is law enforcement assisted diversion, or LEAD. This program focuses on low-level offenders for drug and prostitution offenses. Drug treatment court mainly is an alternative court that allows individuals to enter into a substance use treatment program or rehab with the incentive of a shortened prison sentence or absolutely no prison sentence. Therapeutic versus pharmaceutical treatment. Therapeutic treatments is a form of treatment involving psychological therapy approaches as opposed to medicated therapy approaches. One example that has had positive results is animal-assisted therapy. Inmates have the ability to take care of a dog while incarcerated, not only to provide them needed support, but also give them the responsibility of taking care of an animal's life. Pharmaceutical treatments, the use of medication to lessen withdrawal symptoms and cure addiction cravings. This is a very popular treatment program within corrections, but many authors argue that it is unethical to treat addiction with more drugs. It has been proven to lessen deadly overdose rates after reentry. Labeling theory. Labeling theory can be defined as the way in which society places a label on individuals who have encountered the criminal justice system. It also looks at behaviors of the individual who the label has been placed upon. Howard Becker is one of the most known criminologists associated with labeling theory. An example of labeling theory is an individual who spends a lot of time in a bar will ultimately be labeled as an alcoholic. Strain theory. General strain theory was created by Robert Agnew in 1992. The idea that the presence of strain and stressors in an individual life leads them to a life in crime. Strains in an individual's life can include, but are not limited to, abuse, money issues, neglect, and lack of opportunity to meet positive goals. This can be lack of educational opportunities or career opportunities. When an individual enters into the correctional facility and screened for substance use disorder, they are asked multiple questions about their past trauma and stressors. This allows for medical professionals to get a better understanding of what caused these individuals to conform to a life in crime and drugs, and will allow professionals to be better able to make a successful personal treatment program for the individual. Methodological review. Surveys. A series of predefined questions a researcher formulates on their topic in order to collect data directly from individuals in a target population. After conducting a survey and collecting participants' answers, researchers are able to quantify that data. Researchers will take the answers collected and code them into using numbers. An example from the text is in 2019, Tsai and Gu collected data from the National Epidemiological Survey of Alcohol and Related Conditions in order to evaluate the associations between incarcerated individuals suffering from substance use disorder and the rate in which they seek treatment. Some common advantages and drawbacks of surveys. Advantages include the ability to collect data quickly. It is very cost effective, and it is very simple for participants to use. For this topic in particular, having the ability to get feedback directly from individuals with SUD and corrections allows for better program development and collecting accurate data. Drawbacks of surveys include that they may be interpreted differently from person to person. This leads to the next drawback, which is the potential of questions being left blank. For this topic in particular, not conducting a survey correctly can result in unsuccessful or even damaging programs to be developed. Secondary data analysis. When a researcher collects data from existing research that had a different purpose. When conducting a secondary analysis, researchers will begin by researching other sources in order to indicate what is already known about the topic of interest. By conducting the secondary analysis, Sanders, Shirley Bevan, and Stone were able to evaluate the level of drug use occurring within correctional facilities and provide evidence supporting harm reduction strategies as a way to combat it. Advantages and drawbacks of secondary analysis. Some advantages include that it is quick and cost effective. It allows for the growth in knowledge and allows researchers to skip many complicated steps when gathering data. Drawbacks include lack of knowledge around how the data was collected, and data may be old or too out of date to be relevant to the current populations. Combined limitations of surveys and secondary data analysis. If a researcher collects data from an old study, say before mental health and substance use treatments were provided in correctional institutions, and then takes this data, using it to create survey questions for current inmates, the survey will not represent the participants. Substance use disorder in corrections is constantly changing. Therefore, using secondary analysis to collect data from an old study in order to create a new survey will vastly limit the understanding of current trends in substance use disorder in corrections. If researchers do not collect data or create surveys that can relate to the current inmate population, then the understanding of substance use disorder will remain limited and helpful programs will not be created. Ethical review. For this paper, I used one code of ethics. The Association for Addiction Professional Code of Ethics was used. In Principle 7-15, the obligation to report any and all limitations to a professional's ability to help clients. This can be an issue for individuals who are peer support specialists, who are also going through recovery themselves and do not want to affect their clients' improvements due to their own issues. In Principle 1-8, limitations to confidentiality when mandated by law to attend treatment. This is an issue when individuals are court ordered into a rehab facility or into a treatment program, and the addiction professional does not feel comfortable forcing that individual to provide sensitive and/or personal information if they do not want to. In conclusion, substance use disorder is complex and tricky. The rates of deadly overdose and recidivism in individuals with substance use disorder continues to grow every year. This research provides great evidence to show that harm reduction strategies and treatment programs in corrections vastly helps rehabilitate individuals with SUD and put them on the path to a healthy and happy life. Thank you.